Thank you very much for inviting me here to this bilingual conference in Marrakesh, and I'm glad that I'm able to talk about autism, which has been my bread and butter for the last many decades. We will be doing this session on the genetics of autism spectrum disorders. And by the end of this presentation, I must say that though the listeners, the young neuroscientists, should understand the genetic architecture of ASD, differentiate monogenic from polygenic autism, recognize major autism susceptible genes, appreciate the role of copy genes, which are called CNVs, understand gene environment interaction, know when genetic testing is indicated, and appreciate future uh, precision medicines. Of course, it is a highly inheritable disease, autism. It has a heritability of 70 to 90%, one of the most heritable neurodevelopmental disorders. No single autism gene has been done, but there are thousands of genes which have been implicated. This is what makes everything so difficult when treating and analyzing autism spectrum disorder. Coming to the architecture, there are a lot of things that come into play, but the rare, highly penetrant mutation is extremely important, and that also needs to be addressed. Going further, the genetic variants are also important. What will the participants get from this? They will get review evidence supporting the strong genetic basis. They'll understand the contribution of rare genetic mutations, copy number variants, and common polygenic risk factors. They will also examine certain syndromes like Fragile X syndrome. Tuberous sclerosis is pretty common, and Rett syndrome. And then we'll discuss the gene environment interaction and the influences on neurodevelopmental disorder. We will also talk about the prenatal and post-perinatal risk, which of course come from infections, come from metabolic disorders, come from advanced parental prematurity and environmental exposure. Then we will also examine and see what diagnosis we can make. We can explore standardized diagnostic instruments. We can do multidisciplinary assessment models. We can do biomarkers. We can do emerging technologies. Then we will need to do early behavioral interventions if you are talking of intervention, early behavior intervention, naturalistic developmental behavior intervention, parental mediated intervention, speech and language therapy, occupational therapy, social communication intervention, and of course, educational supports. We will also need to consider future directions in autism research, exploring emerging concepts in precision neuroscience. We discuss the application of artificial intelligence, which is becoming so important in diagnosis of autism disorders. Then we will, of course, examine the potential role of biomarkers, which are also very meaningful in autism subtype. We will need to understand the participatory research involving autistic individuals and neurotechnology that are now showing up in genetic testing, early identification, and of course, envisioning future models of care that integrate neuroscience and developmental psychology. So, in the end, the overall educational outcome, all the conclusion of this, at the conclusion of this presentation, the participants should be able to integrate number one, contemporary neuroscience, developmental science, genetics, and clinical practice to develop a comprehensive understanding of autism spectrum disorder while appreciating the number one, the diversity, number two, the strengths, number three, the challenges, number four, the future opportunities. Hope you have enjoyed this session, and if you have any questions, do let us know.